Stress can do it. I know it sounds like, really? Are you serious? But no, stress can play a role in our blood pressure. And likewise, reducing our stress levels could potentially reduce our blood pressure as well. But it's important to note, reducing your stress levels literally could improve your blood pressure levels. Guys, I've got more tips on how to reduce your blood pressure without taking medications. That's what we're talking about today. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. The next thing is diet. Now, we want to eat a diet that's low in salt. I'm actually going to give you a specific example of a diet that you can actually follow. But a low salt diet is going to be super important for lowering our blood pressure. Now, when I tell this to my patients, a lot of times they say back to me, well, Dr. Caudle, I don't actually add salt to my food. I don't actually use the salt shaker. And the truth of the matter is, you may not use a salt shaker either, but that doesn't mean the foods that you're eating are not filled with salt. Remember, there's a lot of prepared and packaged foods, frozen foods, fast foods, and other things that we may eat that are actually filled with salt. You don't even have to use a salt shaker. So guys, please keep that in mind. The diet that I was referring to, I've talked about this before in many of my videos. It's called the DASH diet, D-A-S-H. That stands for Dietary Approaches to Stop Hypertension. This is a diet that's specifically designed and tested for the lowering of blood pressure. And the truth of the matter is, guys, it works. What you're probably saying, well, what does the diet consist of? Well, it's a lot of good stuff, fruits and veggies and whole grains, low-fat dairy, legumes, nuts, lean meats, lean proteins. Check out some of my other videos where I talk about it. I talk about it in my cholesterol videos. I talk about it. I have a whole video just on the DASH diet. Super important. But our diet is a way that we can potentially lower our blood pressure without using medications. All right, number 3 is stop smoking. Yeah, smoking is so not good for so many things. It's also not good for our blood pressure. In fact, it raises blood pressure, okay? It can raise blood pressure. So stop smoking if you smoke. And honestly, I don't want you smoking anything, any type of substance. Very important. Number 4 is to lose weight. Now, of course, lose weight if you have weight to lose, okay? This has got to be under your doctor's guidance and their advice. But losing weight can actually lower your blood pressure. I have seen it happen. I have had patients that when they lost a certain amount of weight, they were able to come off their blood pressure medications. Sometimes for some people, losing weight can be almost enough to really make a good dent in your blood pressure. So be motivated and be inspired and know there are things you can do. Number 5 is to exercise. Yeah, the act of exercising, the physical act of doing this really makes a difference. It can lower your blood pressure. So if you're not exercising, and this is not solely about weight and your waistline. This is about cardiovascular health. This is about your blood pressure. This is about so many other things. Get your body moving. It makes a difference for your blood pressure in addition to so many other things. And the last thing is alcohol consumption. Believe it or not, too much alcohol can have a negative effect on our blood pressure. And so making sure that you're only drinking alcohol in moderation and in healthy limits can be a really great sort of boon to your blood pressure. What does that mean? Well, according to guidelines, women should not be drinking more than 1 drink per day. Men, that's no more than 2 drinks per day. That's sort of a very sort of quick and dirty nuts and bolts idea. But the idea of minimizing your alcohol intake actually can lower your blood pressure. Guys, these are all things you can do to affect and to lower your blood pressure without medications. This is important, and actually this is very empowering. I want you to feel empowered as though, gosh, there are things you can do to help your blood pressure, because you know what? There are things you can do to help your blood pressure. Guys, I hope this is helpful. Let me know in the comments. Let me know what you do to keep a healthy blood pressure. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. If you've not subscribed to my channel and click the little bell for updates, I invite you to do so. Guys, I'll see you soon.